everyone, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and today we're coming to you from our brand new location in Tannersville. So our Tannersville campus location, located on Route 611 in Tannersville, right next to Friendly's Restaurant. A lot of parking, great new location. On one of the other shows you'll see on Eyecare Today, we're actually going to do a tour of the office and show all of the great things we have to offer for your eye care needs. If you want to check us out on the web, our website is www.drkislan.com, and our phone number here in Tannersville actually, 570-421-3342. And for those of you watching in the Hazleton area, our office in Hazleton is on the Airport Beltway, Hazleton Eye Specialist. That phone number, 570-453-2020. So folks, today I'm very proud to have joining me two of my colleagues, two of the doctors who are full-time eye docs here at our Tannersville location. On my left here is Dr. Brian Olinsky, who's been with our practice now almost 10 years. And on my right is the newest addition to our staff, Dr. Corinne Bellinger. And she's actually a local product of the Tannersville area and decided to come back and practice in her hometown. So we're going to get to meet both our docs today on the show and discuss some of the important things that you might have questions about out there regarding your eye care. So Brian, Corinne, thanks for joining me today. Brian, I'll start with you. Talk to me about why it's important just for people to get their eyes checked. I mean, we think of, maybe someone who's never had their eyes checked, they see good while they're driving, watching TV. Why is it important for them to come in and see us?
Yeah, I think we take our eyes for granted so often. There's so many things that can be happening with our eyes that we can't know are going on unless we have our eyes checked. So many different eye diseases can be starting, and it's good to start a relationship with a doctor to have a baseline.
So that's interesting. People don't think of that. They think they can drive well, see well driving. Maybe they just need reading glasses to read. But you mentioned diseases that can crop up, and some people don't realize that when we look into the eyes, there's things that we can pick up. And what are some of those things that in your 20 plus years of practice that you've been able to pick up on patients that maybe they didn't have any idea about?
Well, kind of starting front to back with the eyelids, sometimes dry eye can be a problem. Heading on into the eye, there's cataracts, glaucoma, and retinal disease. And sometimes we can find out things that are wrong with the patient that they don't even know about just by looking in their eyes.
And what would be some of those things? I know probably diabetes is one of them.
Mm-hmm. Sure, high blood pressure, autoimmune diseases are easily detected by looking at the eyes. The list is endless.
And Dr. Olzinski makes a great point because we've had numerous patients that come in, they think they're seeing fine. We look in the back of their eye, and all of a sudden we say, hey, there's something here that we need to contact your family doctor about and look into a little more aggressively. Dr. Bellinger, you see a lot of kids in our practice. First of all, welcome to the show. This is your first time on the show, and it's great to have you. It's great to have you in our practice. A lot of parents out there have kids who, maybe again see well, not having any trouble in school, haven't had their eyes checked. Why is it important for kids to come in and get their eyes checked?
So it's very important for routine eye screenings, especially for children. They're unable to express how they are seen, and they don't know if how they are seen is abnormal at all. There's many eye diseases that we can pick up early on that would prevent lazy eyes and future trouble.
I think that's a great point. I mean, funny story. I was about 8 or 9 when I first got my glasses, and I actually thought trees without leaves on were just one big brown blob. And I remember getting my first pair of glasses, and I could actually see the individual twigs on the trees and the branches. So that's a great point. Kids don't know what abnormal is. That's exactly true. So, think of all the times that, we've prescribed glasses and kids put their glasses on and their eyes just light up and they're seeing just incredibly for the first time. And a lot of parents think that the screening that the kids get at their family doctor is an eye exam. Is that true?
They do basic visual acuity screenings, so they have the child see how well they can see as far as reading a chart, but it's not necessarily looking at binocular vision, stereo vision, color vision, and there's a lot of types of refractive errors or glasses that are needed to help reduce eye strain that a child can focus through and pass that exam but still need glasses.
Yeah, that's a great point. It's not just about seeing clearly, it's about how the eyes work together. A lot of reading problems can be picked up in an eye exam if the kid's eyes don't track correctly. Definitely things that we pick up that parents may not be aware of, and all of a sudden then the kids, their grades go up a little bit, they're reading a little better, maybe they come out of remedial reading and into the normal reading class. So that's a great point. Dr. Olzinski, so we see, let's say, kids for the first time and we prescribe them glasses and they get a little bit older and now they're playing sports. What are some options instead of wearing their everyday glasses for sports?
Yeah, of course, children have to be active today. They really need their options with glasses. Some can just go without glasses for some of their sports, but when they need them often, of course, there's safety eyewear that's available. A lot more fashionable than what it used to be, and contact lenses, of course, are very important to keep children active in their sports.
Yeah, a lot of parents don't realize that everyday dress glasses are not safety. So God forbid kids are playing basketball and they get hit in the face with the basketball, or they're playing baseball and take a ground ball up in the face. The glasses can break, and the most common places we see it are breakage right at the bridge of the nose, and the frame breaks, and then all of a sudden they get cut. So as far as safety goes, you mentioned rec specs or safety glasses for sports, but contacts can be a definite improvement in not only their central vision but their peripheral vision for sports. And do you fit a lot of kids for contacts now for sports?
Yeah, it's a very common thing we do. It really helps them see things in a way that glasses and rec specs cannot provide. It gives them a totally different visual perception of where things are relative to our environment. It creates a natural vision.
And there's so many options with contact lenses now for patients. It's actually time for a break already, so when we come back from the break, we're going to talk about all the different types of contact lenses that are out there for patients, and we'll talk a little bit about some frame and lens options also, and then some other diseases that we check for when patients come in for an eye exam. So you're watching Eyecare Today, and we'll be right back. Hello everyone, and welcome back to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Tannersville location on Route 611, right here in Tannersville, next to the Friendlies. Our phone number here at the office, 570-421-3342. For those of you watching in the Hazleton office, 570-453-2020. We're located on the Airport Beltway. Make sure to check us out on the web, www.drkislan.com. All of our shows are archived there, so we talk about a lot of different things relative to your eye care needs, so make sure to check out all of our shows. Today I'm joined by two of the doctors who are here full-time in our Tannersville location, Dr. Brian Olinsky, who's been with the practice over 10 years, and Dr. Bellinger, who's the newest addition to our practice and who's actually a Tannersville native and decided to come back and practice in the area, so I'm very honored to have them join me today. On the first segment, we were talking a little bit about just why patients should get their eyes examined, different diseases that we can pick up in the eyes, and specifically with children, there's a lot of conditions that can be picked up in an eye exam that may not be picked up in a pediatric vision screening done at the pediatrician's office, and we were talking about different ways that children can have their vision corrected, glasses, contact lenses, and we started talking a little bit about disposable contact lenses. And Dr. Bellinger, with your experience, daily disposables has become very prominent in fitting now with children. So discuss the benefits of daily disposables, why they're so much better than some of the other modalities that are out there, and why they're just so great for kids.
So daily disposables are contact lenses that you wear one day and you are able to throw them away at the end of the wear time. They're made thinner and lighter, allowing more oxygen into the eye because they don't have to last as long. We don't have to store them in a case, and this allows more oxygen permeability to the child's eye. So more comfortable as well. The other thing is a lot of eye infections are actually not coming from the eye or the contact lens itself, but instead the case. So in the past, with the extended wear contact lenses that you store in a contact lens case, there's a lot of bacteria and infections that can be spread that way, as opposed to throwing the contact away.
That's such a great point. A lot of people don't really think about their case, but we store the case in the bathroom. Patients just don't throw the case away as readily as they should. I've had patients come in and the case is sitting there, it's dirty, it's old, and I'll throw it away, and they almost do the dumpster dive where they just want that case back. But the amount of bacteria that's in those cases is really an issue, and you're absolutely right. With throwing that lens away, we don't have those issues anymore. And years ago, dailies were costly. How has that changed now over the years?
Well, with being out in the market for a while now, the lens companies are bringing the contact lens down in price, and they also offer really great rebates for daily wear, because that's just where the market's going. It's healthier for the eye, whether you're a child or an adult wearing the lenses. It's just overall the best choice.
Right, and we think of not just our pediatric patients, but patients who are working all day, firefighters, paramedics, everyone who's just out there 12, 14, 16 hours a day. At the end of the day, instead of taking a lens out, cleaning it, they can just throw it away, and then the next day they put a brand new, healthy contact lens on the eye. And what I kind of say to patients now and parents is, a year's supply of contact lenses is almost as costly as a year's supply of monthly disposals when you add in the solution that you have to buy to clean them. So it really has changed. So that's a great way for patients to keep their eyes nice and healthy, so they're not coming in for emergency visits and infections and things like that. So now when we move out of the vision correction arena, Dr. Olzinski, one of the most common conditions I know you treat on a daily basis is glaucoma. Tell the folks out there really what is glaucoma and how do we check for it?
Glaucoma is an eye disease that most people don't know they have. It's silent, it's typically painless. It's a disease where the eye pressure, the fluid inside the eye, not the tear fluid, but the actual fluid inside the eye, pressure goes too high, killing the nerve in the back of the eye slowly, painlessly, and robbing our sight. Typically to the sides first, and it can make things very difficult to see.
So it's not a real fast process, and it's not painful, right?
Right, very slow and insidious.
And they call it the thief in the night because patients don't know they have it. So when patients come in for an eye exam, we check their eye pressure, and if it's a little bit high, doesn't mean they have glaucoma. What do you do if you see a patient that has a little bit of high eye pressure?
Yeah, that's a great question. So often we have to do other tests. The tests have to be done to assess whether that pressure is reliable, to make sure it's not damaging the nerve and causing field loss to the side. So we have to check the thickness of the cornea. We have to check the peripheral vision with what's called a field test, and we have to analyze the nerve with another computer.
Yeah, and I've heard you talk to your patients who you're kind of looking at as far as glaucoma, and I'll kind of boast a little bit here that I think we have some of the best technology in the area as far as being able to diagnose, treat, and manage patients with glaucoma. And Dr. Olzinski's right. It's really taking all the pieces and putting it together like a puzzle and making a decision from there as far as whether they need to be treated or not. And what is the simplest treatment nowadays for glaucoma?
So often we can just use what's called monotherapy. It's a drop, one drop. It's in a prostaglandin category, and it's a drop that can be used just once a day, typically at the end of the day. That gives us our best efficacy with least side effects for initial therapy.
And I think it's amazing where technology has gone now where, you know, we can basically take a disease process that could cause someone to go blind, and with one drop, once a day, typically like you said before bed, pretty much preserve someone's sight and never lose their vision. So after you diagnose someone with glaucoma and maybe start them on a drop, they do need to be seen then regularly to keep a watch and make sure whatever treatment you recommend is working, correct?
Yes, definitely. Some people have to be seen every 4 months, sometimes every 6 months. It has to be something that really has to be kept up and maintained. Often we also want to communicate some of this to their primary doctor so that they know what's happening with their eye health as well, so they can help manage other health concerns as well.
That's a great point. Whenever a patient comes in and we diagnose them with one of these conditions, whether it be glaucoma, macular degeneration, and start a treatment, we do communicate with their family doc, because it is important that the family doc knows about these certain conditions. So that's a great point. So everyone watching out there, come in and see this guy and make sure you don't have glaucoma. So we've already come to the end of another segment. We're going to take a quick break here, and we're going to talk about some other eye conditions that may affect your ocular health and vision. So make sure to join us right on the other side of this break. I'm your host, Dr. Thomas Kislan, and you're watching Eyecare Today. Hello everyone, and welcome back to Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you today from our brand new Tannersville location, located right on 611 next to Friendly's in Tannersville. Our phone number at the office here is 570-421-3342. For those of you watching in Hazleton, we're located on the Airport Beltway. Our phone number there, 570-453-2020. Check us out on the web, www.drkislan.com. So again, joining me today, Dr. Brian Olinsky, who's been with our practice over 10 years, and our brand new addition to the practice, Dr. Corinne Bellinger, who is a local native of Tannersville and decided to come back and practice right in her hometown. So I'm very honored to have both of these great docs with me today. Dr. Bellinger, we were talking in the last couple segments about just reasons why patients should come in and get their eyes checked routinely. But sometimes things don't happen routinely, and things pop up, emergencies, accidents, patients taking down their Christmas tree and they take a pine needle in the eye, mother nursing, the baby scratches the mom's eye. All of these things we call emergencies. Explain to me what are some other emergencies that we see in practice, and explain to patients out there why it's important, if they don't feel something's correct with their eyes, they should call us right away.
Right. Well, Stroudsburg Eye Specialist and Hazleton Eye Specialist are unique practices in that we take emergency phone calls 24/7. So we always have a doctor on call, and if you call during our regular business hours, we're very good at getting the patient right in for any type of emergency. Typically we see emergencies that the patient is anywhere from eye infections to foreign bodies. A man was grinding or welding, things like that, and have any type of metallic foreign body. We're able to remove that. Contact lens overwear, we have corneal ulcers, which are extremely painful. And then you have visual symptoms that aren't painful. So those things that spark a patient to have a little bit of anxiety about what's going on with their vision, like new flashes that they see or floaters, any type of visual disturbance, where we're going to get that patient in that day to make sure everything is healthy with the eye.
That's a great point. I just want to reiterate there that our practices are unique because we never turn away emergencies. Like Dr. Bellinger said, one of us is on call 24/7, holidays, weekends, it doesn't matter. If a patient thinks something's wrong with their eye, they should get it checked, because things like retinal detachments, if they're not caught quickly, they can cause permanent vision loss. And what are some symptoms of retinal detachment? So if a patient's on a Saturday morning, they wake up and they see these certain symptoms, what are those symptoms they should call us and talk to us about?
Well, the retina is a unique structure of the eye. Its anatomy, there's absolutely no pain receptors located on the retina. So any type of retinal disease or anything in the retina is not going to cause pain, but you will typically see visual disturbances. With a retinal detachment, most patients come in complaining of flashes of lights. Usually not anything very dramatic, but little flashes of lights. Oftentimes these are associated with floaters, any new type of floaters where you see little black dots or clear dots floating around. And then the biggest one would be the curtain coming over the vision, where a patient is noticing a part of their vision is actually dark or black.
Yeah, and those are things that if we diagnose it quickly, we actually have a retina specialist on staff here. We can usually get them seen really quick and hopefully preserve their vision. Dr. Olzinski, Dr. Bellinger mentioned curtain shade coming over their vision. There's other conditions where you can have a curtain shade come across their vision, certain cardiovascular conditions. Talk to the folks out there about what those types of things could be that would worry us.
Yeah, besides retinal detachment with that causing a sudden loss of vision, sometimes there's some diseases that cause loss of vision from a lack of blood supply to the eye. And they're similar to stroke-like events where arteries either get closed, where blood supply doesn't go to the eye, to the nerve, or an artery swells closed, causing seemingly sudden vision loss. And these are very serious conditions that have to be addressed immediately.
So would you say it's correct that we see these conditions, either pick up the phone, get them in for possibly a carotid scan, MRI, blood work? I mean, what's your typical workup that you would do on a patient like that?
Yeah, usually they need some of the diagnostic imaging here, some stat blood work, things that are done immediately so we find out results same day, typically an immediate CAT scan at the emergency room. And that's something we do coordinate here and contact the emergency room for and discuss with the ER docs one-on-one.
Yeah, a lot of people don't realize that there's, like Dr. Bellinger and Dr. Olzinski said, a curtain shade coming over the vision can be a real serious issue, and it's not something that should be taken lightly. So 24/7, someone is on call here at the practice, so please feel free to give us a call. We've talked about, Dr. Bellinger, we've talked about eye infections, emergencies, routine exams. Is there anything else you might add as far as why patients should come in and get their eyes checked?
Yeah, patients of all ages, starting from young patients or patients of school age, we're now offering vision therapy for binocular vision issues. So oftentimes a patient or a student is struggling in school, and it's not necessarily, their reading level, but their eyes aren't moving together correctly, and that's going to be something that has to be addressed at this age so they can perform normal development in school. For older patients, you have cataracts and macular degeneration. That's something that we would screen for and get early prevention and treatment on something that looks a little bit suspicious for the development of that.
So I think what we've talked to the folks at home about today is from birth all the way till we get in our 80s and 90s, hopefully. Getting your eyes checked is extremely important, and at Stroudsburg Eye Specialists and Hazleton Eye Specialists, we see patients of all ages. We start seeing patients as infants all the way up to senior patients, and there's these eye conditions that can affect at any age level. So please, if you're having any eye trouble out there, or just if you've never had an eye exam, give us a call, come in, have one of our great doctors here check you out and make sure that there's nothing going on besides just an eye problem. Folks, that's going to wrap up this show of Eyecare today. Again, very honored today to have two of my esteemed colleagues honor me from our Tannersville office, Dr. Brian Olinsky, Dr. Corinne Bellinger. both great docs. So give us a call, 570-421-3342, and make an appointment and make sure you've got the best eye health out there. Again, I'm Dr. Thomas Kislan, your host of Eyecare Today, and we'll see you next time.